Welcome to the International Congress of Agorà held in Milan. We are very honored to be here with Dr. Kramer, Eyal, plastic certified surgeon from Israel. Here in the International Congress there are two very interesting topics. The first one, what is the secret of the treatment of patients men with filler?
What we see I think during the last 3 years is a bigger demand from our men patients to come into the clinic and to keep themselves rejuvenated, but they really emphasize that they want a natural look and they want to look more masculine than they are. They want to look less tired, but they don't want the feminine way of treatment that we used to do. And it is a big difference between a male patient and a female patient when we are considering masculine face, because the faces of female has projection, we have light reflection on the cheekbone, and for the male patient we are looking for more a boxy face, very wide jawline, very strong chin, very muscular. We know that today some of my patients are coming before interviews for work because they want to look very strong, very self-confident. So they come and ask for a more masculine, more strong face for themselves. And this is really important because it's not the same technique like treating a female patient. You have to think before you inject. You have to respect the temples, which is less part of the treatments for some of the female patients, even though it's growing these days. But for the male patient, we need to go treating, first of all, the frame of the face, to get a very strong, very straight face on the lateral part, and then giving a very strong jawline, very sharp line, because we want to look like lions actually, very strong, very masculine. And last but not least, we have to keep the chin wide, not doing like we do for the ladies, a very triangular shaped chin. We need to make it wide, more square-like. And another thing which is really important for the male patient is the skin quality. So we use more bioremodeling treatments for the skin of the male patient because it's thicker, so we have superior results for refit, and we need less volumization because the male patient doesn't want to look like he was treated. They want to look the same. They also agree to look still a little bit tired, but at least they will keep their masculine face.
So it's very important to know the anatomy. And
very important, not only the anatomy, also the aging anatomy, the way the face, the bone is absorbed, different between male to female because our muscles, the male patient, the muscles are stronger, more stimulation for the bone, so less absorption. This is why we age a little slower than the female patient, but when we start to age, when we are 50, 55, everything is going downwards and medially, and we become sagginess on the jawline. So you have to choose between getting treated or growing a beard like I did.
So it's very interesting, and we now just talk about the second topic, your technique, C-lift, for a perfect lifting.
Yes. So I was going around the world for different brands, different companies, and I was trying to teach doctors how to have a systemic system for analyzing and treating a full face treatment for the patient. So I looked for different ways, I learned from the best, and then I decided to have one of myself, which is really easy because we Israeli try to keep it simple, let's not say stupid, but simple. So I invented, let's say, a technique which is C-lift, which every letter is for a specific area in the face. The C is for the cheek, L is for the marionette line, F is for the chin, and T is for the temples. And the shape of the letter is also the shape of the injection technique. We combine different product, different G' HA-based product in order to compensate the bone absorption, to create more projection for some area, and then camouflaging everything with a low G', more smooth for the contour of the cheek, for instance, the contour of the chin. We are using cannula for this treatment, so it's very safe, very repeatable, and very easy when you are looking at your patient, you're starting, do I need to do the C, do I need to do the L, how much shall I invest in the F, and what about the temples? So you will never forget the temples, because most of our colleagues still are not used to look for the temples, for instance. Some of them are afraid from the chin because they don't want to create too wide chin for the patient. And when you are using the C-lift, you remember the F, which means that you have a long line in the middle for projection and elongation, and then one line is for the submental sulcus, and one line is for the pogonion for extra projection and for soothing the skin appearance. So by combining all the letters of the C-lift, you get a full face treatment, very safely, very repetitive, and it's like a checklist. You do C, I need to do, L, I don't need for this patient, F, I do, temples, depending on the patient and also depending on the palpation of the depression of the bone in different area. So by combining all this, we get a full face rejuvenation, which respects the neighboring effect. We know that when we inject laterally, we get lifting, we get repositioning of the tissue, so we need less volumization in the midline, which means more natural results and for sure safer result.
So we need innovation, but also the capability to dialogue in a clear way with each patient.
I totally agree. This is also for a common language with my colleagues. You know, when they're sending me a picture, what would you do for this patient? So I'm telling them, I will do the D part of the C, I will do more on the F, less on the L, so I will not create a widening of the chin, because we know when we are treating the marionette, we are widening the chin, and this is not good for our female patient. So by combining this, I have a common language with my colleagues, so I can talk with them, a common language with my patient, and also a common language with my assistant in the clinic, so she can help me. I'm telling her we need to work more on the C and a bit on the F, so she knows how to, you know, price the treatment, because I don't believe in pricing according to the number of syringes. I'm pricing according to the target of the treatment, the complexity, the chances for complication, and the chance that we will need to do more touch-ups.
So really thank you for these detailed scientific, deep clarifications. We are very, very happy to have you here. We thank you for your time, and we thank all of you for listening to us.
Yes.
And remember, we are near Israel.
Thank you so much. It's a great respect for me to come here, and it's a very nice conference. I learned a lot from my colleagues, the great atmosphere, and you know, everything was so nicely managed. So truly amazing, one of the top congresses I've been in the last year, at least.